Well, narrative medicine, or what's called narrative-based medicine, is a form of medical practice that has grown up in the last 30 or 40 years. It takes as its tenet, as its postulate, that most forms of medical communication are forms of storytelling in one way or another, and that the shape of the communication, the rhythms, the gaps, the looping effects, the digressions, the diversions, the entanglements are all part and parcel of people's attempt to communicate about something that might be very intangible, might relate to pain, discomfort, mood, or it might relate to loss of function. These health concerns get put into a storied format, and unfortunately, many doctors and nurses haven't been trained in the technique of understanding the story. Of course, they understand that patients talk about their concerns in a multiplicity of different ways, but they don't see the actual composition as being important. And because of this, patients are frequently interrupted, on average after about 17 or 18 seconds, because it's thought that they're straying off the point, and they're asked more and more closed questions. Do you have a pain here or there? Is the pain sharp or blunt? Tell me about the headache. So the patient is forced to respond by saying yes, no, blunt, sharp, or whatever. Whereas actually what narrative medicine is saying is allow the patient to continue speaking. Ask open questions. Don't ask closed questions. Follow the train of the narrative. Think with the story. These are all important parts of listening to the patient. One of the important things to realize about all stories is that they are told from a point of view. Point of view is the key to understanding the story. You cannot tell a story entirely objectively. It may be that the doctor or nurse believes that they have to extract elements of the story and call it an objective description, but even that has a point of view, the point of view of the doctor trying to develop a case history or pursue a particular point in a disease condition. All stories involve points of view, and it's important to realize that there is no neutral way of talking about health and illness. They're always told, perhaps from the point of view of a caregiver, perhaps from the point of view of a parent, or perhaps from the point of view of the person paying for the health care. Narrative medicine also recognizes that most stories embody uncertainty. Indeed, that's why the patient often comes to consult, because they have a story to tell and they feel uncertain about it. They don't know what it means, they don't know what it perhaps signifies. They're coming for some form of interpretation. So narrative medicine recognizes that the story itself expresses uncertainty. Maybe the narrator, maybe the person telling the story is also unreliable. Perhaps they are pursuing an angle that isn't productive. Perhaps they feel locked into a pattern of responses that is just coming up against barriers, doesn't open a way forward for them. So the story itself expresses uncertainty. It may be told in an uncertain voice by a narrator who it's difficult to credit with full veracity. And so you can see how complex it is communicating in healthcare. You have uncertainty of the story that needs interpretation. You have a narrator who may be motivated by impulses that they're not even fully aware of. The secret of stories is to recognize that they express complicated truths, not simple truths. If in the clinic you're looking always for simplification, if you're looking for always a reduced version of what is going on, then you will miss a great deal that may matter in the life and health care of somebody who is ill.